Hello everyone, welcome back to our YouTube channel. I hope you are enjoying the videos. For more insight on HR practices and real corporate world exposure, please subscribe to our channel, like the video and do share it with others. Also, please press the bell icon to never miss an update from HR Success Talk. Thanks a lot. Enjoy this video.
Good morning, good afternoon, good evening. This is Amit Ganeti. I would like to welcome you on behalf of Offline LinkedIn community and its COVID response team. Let me first introduce you to Offline LinkedIn community. This is a community that has been created to serve people. It's been about 5 years. This community is into existence across Delhi NCR region, and recently we have added locations like Mumbai and Bangalore. Overall, we are a community of about 500 members, and out of which I can say that 100 plus members are currently active in different programs and initiatives. This is managed by a group of advisors and led by the active members of the community that are running and involved in different programs and initiatives. Usually we have about 2 meetings in a month, either virtual or physical. Interestingly, so far, the community is being run with zero investment, zero funding, and zero membership fee. Our head office is based out of Faridabad, that is headed by Himanshu Singhaji. Let's talk about our COVID response team. We went live with this initiative on 27th of April this year. When a country got hit with the second wave of COVID, we started brainstorming on this initiative to support the COVID impacted families with the required resources. We split the entire initiative into different buckets like food, oxygen, medicines, consultation, labs, hospital beds, etc. For all of these buckets, we created an active database of resources that is being verified at every 24 to 48 hours interval. About the volunteering into this initiative, we have more than 50 community members who have taken part through the different steps over last 1 month and still continuing their efforts in this initiative. I'm proud to say that we have benefited more than 250 families with this initiative through our formal channel of inquiry system, and we have supported more than 500 families through one or other different way. I'm glad to say that most of the inquiries that we received, we were able to respond within the same day. And we did not close the inquiries just with the response. We did follow up with the patient or the patient family. Let's talk about these buckets in detail, starting with food.
Hello everyone, my name is Rajpal Singh and I'm a part of Offline LinkedIn team, and I am in charge volunteer for the food aspect of the Offline LinkedIn response team for COVID-19 situation. This started somewhere around 20 days back when we felt the need to provide home cooked and nutritious food for COVID affected families who could not manage on their own. And then we started providing food to these families with the help of numerous volunteers all across Gurgaon. And since then, we have been able to provide nutritious meals, lunch and dinner to COVID affected families, and we have helped over 200 families in the past 20 days. We are also currently serving somewhere around 30 families. The food is cooked in homes of the volunteers and then we deliver it to the doorstep of COVID affected families either by ourselves, or since the lockdown has started, we've been using paid services like VFast, Porter, Uber, and we try to give them food on time and also give them medication or anything else that they require because they cannot get out of their house. And that's all we do. Thank you.
नमस्कार, मेरा नाम अशोक है। मैं पिछले 1 वर्ष से ऑफलाइन लर्निंग ग्रुप से जुड़ा हुआ हूँ। कोविड-19 की स्थिति को देखते हुए मुझे और मेरे साथियों को ऑक्सीजन सिलेंडर, कंसंट्रेटर और ऑक्सीजन रिफिलिंग के साधनों की खोजने का दायित्व सौंपा गया। हमने लोगों को ऑक्सीजन सिलेंडर, कंसंट्रेटर और ऑक्सीजन रिफिलिंग जैसी जरूरी साधनों को खोजने में लोगों की मदद की। हम सभी ने मिलकर उन साधनों की अधिकतम संख्या की खोज की जिससे लोगों को हमारे द्वारा सहायता प्रदान कर सके। हमारी टीम के सभी सदस्य पूर्ण रूप से सक्रिय थे, जो सभी लीड की जांच करने के पश्चात अपने डाटाबेस को अपडेट करते थे, जिससे सभी लोगों को पूर्ण रूप से सही जानकारी और उचित सहायता प्रदान की जा सके। हम इस कार्य को आगे भी इसी प्रकार से कर रहे हैं और मैं अपने सभी साथियों को धन्यवाद करना चाहता हूं कि वो हमेशा इस कार्य के लिए तत्पर तैयार रहते हैं। धन्यवाद।
Hi, I'm Akshita and I am a team lead for hospital beds at Offline LinkedIn Community. Well, to share my experience with beds specifically, it was a journey that me and my team covered together. One of the most difficult resources to support in these times because hospitals were running out very quickly. We continuously had to create a database on an everyday basis. We have to verify it all the time. But I am happy that we were able to support 50 plus inquiries only of hospital beds and we were able to save some lives. This only happened because we were very rigorous in our operations. Whenever a person called us and filled the form for the requirement of any kind of bed, ICU, ventilator, or oxygen bed, we used to first take his information and try to find any hospital bed near his location or as close as possible. Verify that particular hospital out of a lot of hospitals that we were gathering the information for on a day to day basis. The one hospital or two hospitals that used to say that yes, we do have a verified bed, that was a verified lead for us, we used to share their number so our patient does not have any trouble. It has been the most urgent requirement and we have been serving it and we hope to serve it more. So we have a dedicated team who continuously calls and check with hospital. It was initially in NCR and now we have spread it across. So hopefully saving some lives at Offline LinkedIn.
Hi, this is Aman. I'm the part of an offline in community. We are trying to help people with the different resources and their requirements in this tough time. I personally took the responsibility of helping people with the medicines which are required to cure their patients in this time. In the initial days, the medicines were short, the chemist shops, the hospitals were out of the stock, the patients and the attendants was worried to find out the medicines and they are failed to do so. We took an initiative to help the people with the right resource and with the verified lead so that they can save time and the patient get the medicines in the right time. We also encourage people not to buy the medicines from the black market and on the high prices. We also ask them to please go and talk to the doctors and the drug controller to seek the advice so that they can help you with the right medicines in the right time and the life of a patient can be saved.
Another aspect of our COVID response team was providing with lab services. In initial days, there used to be a big queue at selected lab services. There were no home tests available and even the normal COVID tests and other RT-PCR tests were also not easily available. We partnered with Health Heart, SRL and Dhani app for lab tests and made the home collection available at a very genuine price across Delhi and NCR. There were verified labs and walk-in drives for lab tests. We supported more than 20 queries on lab requirements and continue to do so.
Good morning. My name is Vineet Mangal. I'm part of Offline LinkedIn community, wherein I lead the function of ambulance and emotional well-being of the people. Under the category of ambulance, we have realized that during this pandemic, a lot of issues were there when people were not able to get the services of ambulance or they were getting it at a very, very high price. So we thought that we'll create a pool and a verified lead wherein we will bring in specialized agencies who can provide these services at a reasonable cost and with a very good response time. So we were fortunate enough to have some tie-ups done on this part, wherein we got a few agencies, those who are specialized in a big network of ambulances, and also we could have someone who has the facility of air ambulance also if the requirement is there. We could help a lot of people because of this, because the first and the foremost requirement is to transport the patient, which if it is not done on time and at a price, it becomes a challenge for them. So this partnership which we did with some of the companies can give us a good foothold in Delhi NCR region, and we were able to help a lot of people. With respect to the consultation on the emotional well-being, what we realized is that when this pandemic hit us hard, a lot of people got into some kind of anxiety or also kind of a confusion what to be done, who should be consulted with. And this was not only happening with the people, those who are suffering or their family members. We also realized that even our volunteers who are giving this help to all the people, they at times also goes into that issue of anxiety or hopelessness, because so much to do and we find it difficult to address everything around us. So with that point in mind, we decided to sign up with specialized agencies for this, and we could sign up with one established organization which provide the emotional wellness. They have their own set of doctors, therapists, counselors for this, and anybody who has any such requirement, they can reach out to them and they help them out in sorting out this issue. We personally feel that this issue of mental wellness or emotional wellness, if we can call that as, is going to remain forever, even after this pandemic, because a lot of trauma has happened and people will be requiring this service. So therefore we thought that we will create this as one of the category where we will connect people with the required help which they need into mental and emotional health. So right now we are working on this. Thanks.
My name is Amit Agrawal and I'm one of the volunteers of the Plasma Group. I'm also leading this group along with Samirji. So we are a team of around 15 volunteers, and we are working on a daily basis to cater to the requirements for the plasma patients. Now, when we initially started considering the criticality of the plasma resource for the COVID patients, we had very less verified information available with us. So that was the first task taken by our plasma group. We verified all the messages, or I would say we verified the information which was coming to us in the form of messages from various social networking sites, Twitter, WhatsApp or other sources. And we were verifying it, whether it was about the NGO, their contact numbers, whether it was about the plasma banks or their contact numbers or other sources as well. We were verifying all that thing. And we made sure that we passed on whatever request that was coming to us. We only passed the verified information to our patients. That was something which was very critical for them. We also provided them the list of sites where they can go and register themselves as plasma patients. So that were two things that we were doing for them. The other thing that we were doing, the other two things that we were doing as a part of our plasma campaign was to increase the awareness among the people to go for the plasma donation. At the same time, we were also preparing a list, preparing a database of the plasma donors, so that they can we can directly have the mapping between the plasma donors and patients based on the blood groups, and in case the blood group matches, then we can directly provide them the contact number. And we had also launched a social media campaign to spread awareness and also for the plasma donation drive. So that's a bit of what we had done as a part of Plasma Group.
So that was from our COVID response team at Offline LinkedIn India. To know more about us and our volunteers, or for any other request related to COVID, please visit offlinelinkedin.com. We are also available on social media on Facebook, Twitter, LinkedIn, and Instagram. Thank you so much.